Hello and welcome to COVID Conversations here on WNCU 90.7 FM, streaming on YouTube, on Facebook and Instagram. I'm your host, Kimberley Cartwright. I'm the News and Public Affairs Director here at WNCU. And we're using the Zoom platform to talk about how COVID-19 is affecting our world. The Centers for Disease Control has authorized COVID-19 vaccines that are now available for everyone 5 years old and older. Here today to talk about what that means for the state's children is State Health Director and North Carolina Department of Health and Human Resources Chief Medical Officer, Dr. Elizabeth Tilson. Dr. Tilson, welcome to COVID Conversations.
Thank you. I appreciate you having me.
You're welcome. First question, how many children do you estimate in the state are eligible to get the vaccine?
Yeah, so our children aged 12 to 17 are adolescents. There's about 800,000 of our adolescents 12 to 17. And then kids 5 to 11, there's about 900,000 5 to 11.
That's a lot of kids in the state. I always thought about kids in the state, but I never thought about a head count. So that's a lot of kids. So how many?
Yeah,
Go ahead.
So we're a young state. We have a big pediatric population. Yeah.
Very good. Lots of young, strong minds and bodies ready for the world. How many children have gotten the vaccine so far?
Yeah, so for our 5 to 11, those are the most the newly authorized. More than 82,000 5 to 11-year-old children have already had the vaccine. And amongst our adolescents, the 12 to 17-year-old, and they've been authorized for longer, almost 360,000 of our 12 to 17-year-olds have had the vaccine.
So what's like the percentage like? So how many more kids to get the vaccine?
Yeah, so amongst our adolescents, and again, they've been authorized a little bit longer, it's almost 50% of those adolescents have been vaccinated. Our 5 to 11-year-olds, and it's only been about a week and a half, almost 10% already of our 5 to 11-year-olds have had the vaccine.
So tell me, what is your biggest concern about the vaccine being administered to children? I know parents have all kinds of concerns, but what is your biggest concern?
Yeah, so I've looked at this data. I think we have a lot of great data on the vaccines with being given to adults and adolescents. We have great data there. And then there were really big trials looking at these younger kids, really good safety profile, really good effectiveness. So I don't have concerns in terms of the data of the vaccine. What I have concerns is that I want to be sure parents are not seeing misinformation, seeing things on social media and making decisions based on misinformation. What I really want is parents to go to trusted sources of information, to our DHHS website, to the CDC website, and make sure they have accurate information on which they're basing their decisions for their children. So that's my biggest concern, is that parents are looking at the misinformation as they're making decisions for their kids.
So what is out there? What are people saying in this misinformed population?
Well, I think the biggest thing to remember is that, again, these vaccines, we have a lot of experience with these vaccines, incredible safety information on these vaccines, the most robust safety surveillance of any vaccine effort, really great safety information for these vaccines, and really great effectiveness on the vaccine. So that is what I want our parents to know, is that lots of great safety and effectiveness data.
So can we talk about the effectiveness for children?
Yeah, I'd love to.
How effective is it? Yeah, how effective is it? And what's like some of the data about it?
Yeah, so with our adolescents, really good immune response and really great effectiveness, about 90% effectiveness with our adolescents. With our children, they found the important thing to know is for the children 5 to 11, it is 1/3 of the dose for adolescents and adults. So the first question was, with that lower dose, are you still going to get the same amount of really good immune response as adolescents? And yes, the same robust immune response, even with 1/3 of that dose, which is great. And then about 91% effective in preventing symptomatic disease as well. So really good effectiveness data in our kids.
Very cool. So I want to talk about now the actual drug that the adolescents and kids are going to get. So there's Moderna out there, there's Pfizer out there, there's J&J out there. So what will young people be exposed to?
Yeah, this is a really, really important question, something that, for our parents to navigate. So right now it is only the Pfizer vaccine that is authorized and recommended for anybody under 18. So that's really important. So anybody 5 to 17, it is only the Pfizer that is authorized and recommended. For adults 18 and up, they can get Pfizer or Moderna or Johnson & Johnson, but anybody under 18, it is only the Pfizer product. And as I said, for 5 to 11, it's a pediatric dose, it's 1/3 of the dose. For 12 to 17, it's at full strength dose. So as parents are looking to navigate, they just need to be sure they're finding a provider that has the pediatric dose if they're 5 to 11, and then the regular dose for the 12 to 17. But it's just Pfizer right now that is available for our children.
So doctor, any information why just Pfizer and why not the other ones?
Yeah, so Pfizer just started their clinical trials a little bit earlier, so they had that data that was ready earlier to be reviewed. Moderna is doing trials with younger kids, and so they're collecting that data and will be submitting that data. I anticipate that it is likely that Moderna will also be authorized for kids, but they are just waiting a little bit and taking more time with those clinical trials. And Johnson & Johnson, they started later as well, and those clinical trials are going on with kids, but just taking them longer to collect that data. So Pfizer was just kind of ahead of the crowd and moving along with their clinical studies and submitting their data.
The next question I have is it free? I know people are probably concerned about insurance or paying out of pocket. So how is it administered? Do people have to pay for it?
That's a really important and great question. And the answer is yes, it is free. There should be no cost to people getting the vaccine, really important. The other really important piece is that showing identification, showing government issued identification is not required. Being a US citizen is not required. And so those are really important. It's accessible to anybody living in North Carolina for free if you're 5 and up.
Mm-hmm. So as a medical profession, one of our professionals, one of our top in the state, I want to pose this question to you. There are people out there who have seen information about getting vaccinated, and there are probably people out there who will never, ever get the vaccine and definitely not get it for their children. So what is your recommendation for people who feel that strongly about whether or not they'll vaccinate themselves or their children?
So one thing is that I really applaud people who are wanting to make an informed decision, that they're reading, that they're wanting to understand and make that informed decision. That is incredibly important for all of our people to be making an informed decision. But again, my concern is the information some people may be getting is misinformation, and they're making that decision based on misinformation. So I really want to be sure that people are going to those trusted sites, our DHHS site, on the CDC website, really looking at that data for themselves, that's trusted information themselves to make that decision. That's my biggest plea to them, is make that decision based on trusted sources. The other piece is that as we see more and more data and the protectiveness of these vaccines get better and better every week. Every week we look at data, and for this most recent week, what we found is that people who are not fully vaccinated are more than 6 times as likely to get infected than people who are fully vaccinated. And even more compelling, people who are not vaccinated are almost 21 times more likely to die from COVID-19 than people who are not vaccinated. So as you're looking through the risk benefit of the vaccines, I really want people to understand the risk of not being vaccinated. 6 times more likely to get infected, more than 20 times more likely to die if you are not vaccinated. And that's a really important piece that I think some people don't look at. So I want to be sure people are looking at both sides of that. And then if choosing still not to get vaccinated, then it's really important then to do the other layered prevention measures. So wearing a face covering, making sure they're getting tested, making sure they are physically distancing, and making sure they're not going to high risk settings like crowded indoor settings where they can be exposed to a lot of other people. Really important, those other layered prevention strategies, if people are choosing not to get the most important prevention strategy, which is vaccine.
So now on to some of the side effects, especially with children. So what are some concerns there?
So what we find children, the most common side effects is similar to adolescents and adults, and actually maybe even a little bit less, likely because the dose is a little bit less. But things like a sore arm, fatigue, headache, those kind of things typically come on about a day or two after the vaccine, and typically only last about 24, 48, at most 72 hours. So that's really the most common side effect. In the clinical trials, they saw no serious side effects, no deaths, no serious concerns at all, just these temporary side effects from the actual vaccine.
What are some of the parents saying? What are the biggest concerns that parents are having about the vaccine? And have you been interviewing people? Have been people writing to you? What are the biggest concerns that they have about their kids and the vaccine?
So a couple things that overall that we have heard from people is that there is a perception these vaccines were developed really quickly, and therefore, how can we trust something that was developed quickly? And so I want to be really clear that the technology of these vaccines, especially the messenger RNA vaccines, that's Pfizer, Moderna, that science and that technology has been around for years. So the technology is not new. The mRNA methodology is not new. What is new is being able to pivot specifically for this virus. But the messenger RNA technology vaccine has been around for a long time. It is just being able to pivot for this vaccine, and some policies that allowed for some of the administrative and manufacturing pieces to be more streamlined. So I want to be sure people know these vaccines were not developed really quickly. The technology is around for a long time. We just did it more efficiently. So I think that's a really, really important piece. And that's what we hear from people as the biggest concern. So they've been really around for quite a while. And the other piece that we hear is concerns about maybe there's long-lasting effects of the actual vaccine being in your body. And so I want to be really clear about that. The way these vaccines work is that you get the vaccine, it prompts your body to create an antibody. That is what protects you if you to see the actual virus. And all the rest of parts of the vaccine goes away. It degrades, it's not long lasting. So you don't have the vaccine in your body long lasting. What you have is just that long lasting antibody, just like with any other vaccine. That's what's lasting. So those are the two things that I hear that I always like to be really clear about.
So what about, okay, for me, I'm eligible to get a booster. Any information coming in the pipeline about what possible boosters would be like for children?
Well, I think we're pretty far away from any data looking at boosters for children. And again, all of our recommendations are really based on data, right? So the data for adults for boosters, that really understanding for those adults that had the 2 doses of Pfizer, Moderna, or the 1 dose of Johnson & Johnson, really having to look and see that time for how long do you have that protection? Does it look like it is waning? When is it waning? What's the risk benefit of the booster? All of that is all of our recommendations are based on data. With kids, we absolutely have to wait to see what is that data, what does it look like in terms of an immunity waning? Who knows? Kids may actually have a little bit more of a robust response, so that we may have a longer time between boosting. But we really have to wait to look at that data before we would want to hypothesize of when and if they would need boosters.
Hello? So I want to talk now about the availability of the vaccine. Where can parents get the vaccine for their children if they're interested now? And do you have to have an appointment somewhere to be able to do that?
So a couple things with availability. One, we're in a very different place with kids than we were right in the beginning when we were vaccinating adults. We have much greater supply, which is great. And we have so many more providers who are actually doing it. So we have about 850 sites across the state where they have the pediatric vaccines. So that's really great. And we've intentionally tried to make sure it's accessible for everybody where they feel most comfortable getting the vaccine. So we have a good supply that is in some of our pediatric offices, our family medicine offices, our primary care offices, because some parents may be more comfortable getting it in a place with their trusted healthcare provider. So we have it a lot in our primary care. We also have community sites that are setting up, especially family-friendly community sites, so that parents and their kids can come together. Maybe a parent can get their booster at the same time their kid get their primary vaccine, and they can come as a family unit. We definitely heard from a lot of families that's what's more comfortable for them, is a trusted place in their community they can come as a family. So we have that. We also have pediatric vaccine available in pharmacies. A lot of people are choosing to do it at pharmacies. It's convenient, it's there. So we have a lot of different places that really, depending on where a family feels comfortable getting the vaccine. The easiest way to find out where the vaccine is on our myspot.nc.gov. You can go to that website, you can put in your zip code, and it will tell you, these are all the places right around you that the vaccine is available. And you want to just be sure you're clicking on the pediatric version to know who has that pediatric supply. And then for appointment versus not, it really depends. Some of our pharmacies are having people make appointments, but our community sites, what we're really hearing from the community is, no, we don't want appointments, we want walk-ins. So it really depends on the site and trying to be responsive to what people have said who are coming to those sites is most convenient for them. So it really depends. And then on that myspot.nc.gov, it will tell you if you need an appointment versus not.
Our time is come to a close, and I appreciate your time. State Health Director and North Carolina Department of Health and Human Services Chief Medical Officer, Dr. Elizabeth Tilson. Thank you so much for your time today and your valuable information. If you don't mind repeating that website for me again.
Sure, myspot.nc.gov. You can find
MySpot. Go ahead.
myspot.nc.gov.
Thank you so much for your time today.
Oh, thank you so much. This has been really fun, and I appreciate getting the word out.
Yes, and thank you, audience, for watching via YouTube, Facebook, and Instagram, as well as listening on WNCU 90.7 FM. Be sure to like us. We want you to follow us, and we want you to subscribe to our pages to see more of our archived shows. I'm Kimberley Pierce Cartwright. Thank you again for listening and watching COVID Conversations here on WNCU 90.7 FM.